Good morning all. I am Dr. Kadiri Bhanu Varun Kumar, neonatologist and pediatrician from Rainbow Hospitals, Kondapur. Today our topic of discussion is abnormal sounds in infancy or children. Generally in infants, usually parents get worried due to any abnormal sound they hear. First, we'll start our discussion from upper respiratory to the lower respiratory. So upper respiratory, usually common scene is noisy breathing. Noisy breathing is a thing which is seen within first 6 months of life, and that is due to blocked nose or any secretion cooling up in the mouth. That is a normal breathing pattern. There is no breathing effort involvement in that, and only blocked nose is there. The only treatment is nasal suction and removing of the secretions from the mouth. The second thing is stridor. Stridor is one gasping sound which is heard from the vocal cord, that is vocal cord. That is due to the narrowing and inflammation of the vocal cord. That is usually seen from congenital or due to any infection. For that, gasping sound is heard while expiring. Third most common type of abnormal sounds are wheezing. This is usually musical whistling sound which is heard during expiration, and usually this is due to inflammation of the terminal bronchiole, trachea, bronchiole system, and these may be due to involvement of respiratory muscles. And the fourth one is grunting, which is a low pitched sound which is heard where the terminal or alveolar sacs are involved, where due to inflammation of the alveolar sacs which we see, or soft tissue lung disease usually. And for any abnormal sounds in the infancy time or below 5 years childhood time, it is always better to show to a pediatrician nearby you and take the medication.